Hello, I'm Dr. Brandt Gibson, and tonight I want to talk to you about plantar fibroma. And we're going to do this again by the 4 questions. Number 1, what is plantar fibroma? Basically, when you come to tumors or cysts, there are multiple different types. There are fluid-filled cysts or gelatinous type cysts, which include ganglion cysts as the most common. There are fatty cysts, which we talked about in just a recent video, called lipomas. And then you have a fibrous or scar tissue type cyst, which are called fibromas. And they're actually overgrowth of fibrous tissues, ligaments, and those kind of things. So in the case of a plantar fibroma, it's a thickening of the plantar fascia that creates a fibrous tissue or a fibroma. Excuse me. And so the idea there is you're actually literally going, okay, I'm treating a thickening of the plantar fascia, and because that's what the fibroma is, and they can become pretty painful, where you can actually get pressure on those spots, and they actually hurt quite a bit on the bottom of the foot. Number 2, why do they happen? Injury. The most common reason is you have an injury to the plantar fascia, tear, strain, something like that, and the body tries to heal, but it overheals, and it creates a thick, fibrous tissue in that area. You can also get it for genetic reasons. There are individuals that just produce fibromas, and this is one of the fibromas that it could be produced, a plantar fibroma. Number 3, how you treat these at home. If you have a plantar fibroma, if you have a thickening in that area and you can take pressure off of it, whether it's certain types of insoles or whether it's padding around it, if you can take the pressure off it, the pain goes away and you don't have to treat it any other way. But a lot of times that's not going to be sufficient and you will need to be treated. Number 4, when you go to the doctor, when it's pretty significantly painful and the things you're doing aren't working, you go to the doctor and there are multiple things that can be done. Everything from lasering this area to cortisone shots to try to see if you can get it to decrease in size. There are some medications that sometimes will work to decrease size. Most of the time, you're going to need to go in and take this fibrous tissue out through surgical means. This is Dr. Brandt Gibson. This is your podiatry tips.